Welcome to Nursing School.
Welcome to Nursing School.
Death and Dying. Part 1. Death is a natural part of life and comes to all beings. It is the end of life and all the vital processes. Legal death is the total absence of brain activities as assessed and pronounced by the physician. Death is the final, the end of life. Everyone from his/her childhood to adulthood experiences various losses and thinks about concrete and abstract concepts to understand that death. For infants, they do not really understand well that concept. At the stage of childhood, they believe death as a temporary state and think that the one death can be avoided. To adulthood, everyone accept the reality of death as final and irreversible, but make them to be very frightened. They encounter the death of their family members, peers and friends. Religious and cultural beliefs play major role. To elderly, death may be viewed as more desirable than living with poor quality of life. They fear prolonged illnesses, they encounter death of family members and peers, and they see death as multiple meanings, freedom from pain, meeting their ancients. The nurse's knowledge of these developmental stages helps in understanding some of the client's responses to a life-threatening situation. The primary course of action when death is near is to fulfill the dying person's wishes. If the person is dying from an illness, ideally, they will have participated in decisions about how to live and die. There is two types of death: clinical and biological death. Clinical death: this is when someone's lungs and the heart stop working. Usually the lungs will stop first, then shortly after that the heart will stop as well. All living tissue in the body needs oxygen to survive. Because of this, treating clinical death is vital to keeping the organs alive. Biological death: this is when brain cells begin to die because of lack of oxygen. Once the body does not have oxygen, it takes about 4 to 6 minutes until brain cells begin to die. After about 10 minutes without air, there is a high chance of irreversible brain damage. Symptoms. Cardiopulmonary criteria have traditionally been used to declare death. When breathing ceased and the heart no longer beats, the person is said to have died. Signs of death. Common symptoms include nausea and vomiting, dyspnea, respiratory secretions, pain, agitation and restlessness, anxiety. Clinical signs of imminent death: muscle weakness, difficulty with speech, swallowing, movement, incontinence, jaw sags, respiratory changes, Cheney-Stokes respiration, death rattle, sensory changes, circulatory changes, cyanosis in extremities, cold skin, decreased BP, slow pulse, poor or decreases sensation. Let's talk little bit on dying. If an individual is dying from a chronic illness as he is nearing death, each day the person may grow weaker and sleep more, especially if his pain has been eased. Near the very end of life, the person's breathing becomes slower, sometimes with very long pauses in between breaths. Some pauses may last longer than a minute or two. You will know death has happened because the individual's chest will not rise and you will feel no breath. You may observe that the eyes are glassy. When you feel for pulse, you will not feel it. Phase of dying. The first stage is called the preactive phase of dying and the second phase is called the active phase of dying. Preactive phase. Person withdraws from social activities and spends more time alone. Person desires to speak to family and friends and make amends or catch up. Increased anxiety, discomfort, confusion, agitation, nervousness. Increased inactivity, lethargy, or sleep. Loss of interest in daily activities. Increased inability to heal from bruises, infections or wounds. Less interest in eating or drinking. Person talks about dying, says that they are going to die or asks questions about death. Person requests to speak with a religious leader or shows increased interest in praying or repentance. Active phase. Person states that he is going to die soon. Has difficulty swallowing liquids or resists food and drink. Change in personality. Increasingly unresponsive or cannot speak. Does not move for long periods of time. The extremities, hands, feet, arms, and legs feel very cold to touch. Not all people show these signs. These signs of death are merely a guide to what may or often happens. Some may go through few signs and die within minutes of a change being noticed. Nursing care to dead body. Care before death. When dying is recognized and expected, it is accepted that appropriate care can take place before death. Discussions between medical and nursing teams about a range of different issues can allow unambiguous communication and preparation of the patient who is dying and their family. Such discussions include: it can also be helpful, where possible, to ask the dying person where he wants to die, who they want to be present at the time of death, and how their spiritual/individual needs can be met. In communal settings, it is helpful to offer patients and their families the option of single-room accommodation if available. Care at the time of death. Informing the medical practitioner who is primarily responsible for the person's care. They also now involve recording in the written notes details of the death, including the time, who was present, the nature of the death, details of any relevant devices, such as cardiac defibrillators, or treatments, like radioactive procedures. Care after death. Care after death/post-mortem care. Definition: care after death, also called post-mortem care, consists of the care given to the body after death. Purpose: to show respect for the dead. To prepare the body for burial. To prevent spread of infection. To show kindness to the family. Equipments needed are: basin for water, washcloth, and towel. Cotton. Gauze. Dressings and tape if necessary. Clean sheet. Stretcher. Forceps. Name tag. Glove. Procedure: note the exact time of death and chart it. Call the doctor to pronounce death. If the family members are not present, send for them. Wash hands and wear clean gloves according to agency policy. Close doors of the room or pull curtain. Raise bed to comfortable working level. When necessary, arrange for privacy and prevent other patients from seeing into room. Close patient's eyes and nose and mouth. Put cotton wool. Remove NG tubes and other devices from patient's body, such as for fluid, urinal catheter, rectal catheter, and other particularities. Place patient in supine position. Replace towel dressing with clean ones when possible. Bath patients if necessary. Brush or comb hair. Apply clean gown. Care for valuable and personal belongings and document. Allow family to view patient and remain in room. Attach special level if patient had contagious disease. Await arrival of ambulance or transfer to morgue. Remove gloves and wash hands. Document the procedure. Accompany the family according to the possibility. Symptoms of normal grief, feelings: sorrow, fear, anger, guilt, or self-reproach, anxiety, loneliness, fatigue, helplessness/hopelessness, yearning, relief, cognitions, thought patterns, disbelief, confusion, or memory problems, problems making decisions, feeling the presence of the deceased, physical sensations, headaches, nausea and appetite disturbances, tightness in the chest and throat, insomnia, oversensitivity to noise, sense of depersonalization, nothing seems real, feeling short of breath, choking sensation, muscle weakness, lack of energy, dry mouth, behaviors, crying and frequent sighing, distancing from people, absent-mindedness, dreams of the deceased, keeping the deceased's room intact, loss of interest in regular life events, wearing objects that belong to the deceased. Assisting clients to grieve successfully. When working with bereaved clients, encourage them to recognize the loss by acknowledging the loss. Express feelings related to the loss. Remember the deceased in a realistic, versus idealistic, manner. Relinquish old attachments of the deceased, example, give away some of the deceased's possessions. Readjust to the community without the deceased. Reinvest the emotional energy into something else, example begin to socialize.